Ask the Experts platform is a monthly segment that offers an opportunity for Namibian journalists to engage noted experts in one-on-one discussions on the COVID-19 pandemic. Journalists get to pose questions to experts in various sectors to ensure that they are equipped with the necessary information to better inform their readers, listeners, and viewers. COVID-19 is our common enemy. Together, we can defeat it. Proudly brought to you by the Namibia Media Trust and the DW Academy.
Good morning, everybody, and welcome to another session of hashtag Ask the Experts. Actually, our last session for the year. Well, last week's session was actually going to be the last session for the year, but then Omicron happened. So this is actually what we will be unpacking today. The fact that COVID-19, unlike us, does not go on holiday. I will be your moderator this morning, Nina Katangana, and I apologize in advance if my throat is a bit scratchy and there's a bit of coughing and sniffles. I'm extremely under the weather. Nonetheless, to get on with today's program, our expert that we will be engaging today is Ms. Emi Elsa Ndavaitela, who's the pillar head of epidemiology at the Ministry of Health. Also joining us is a journalist from the Namibian newspaper and Desert Radio, Shaligan Peterson, and we hope that a bit later on in the program, perhaps Dr. Haufiku will make an appearance. But last but not least, we also have Salma Moses, our sign language interpreter, joining us this morning. Good morning and welcome, Salma and Shaligan and Ms. Ndavaitela. Thank you so much for joining us. I'd like to start, Ms. Ndavaitela, with giving the first question to you, just for you to talk us through, the characteristics of this Omicron variant of the COVID-19 virus. We do know that each variant that does come forth is not the same as the previous. Some more potent than the other, some not. But talk us through the characteristics of the Omicron variant.
Thank you very much, Nina. Good morning, and good morning to viewers, to listeners out there, and thank you for having me. As I was introduced, I'm Emi Elsa Ndavaitela from Ministry of Health and Social Services. I'm heading surveillance pillar in the COVID-19 response. The characteristics of Omicron variant, as we have heard that WHO have designated this variant, which is a variant B.1.1.529, and it was named then Omicron. It's designated as a variant of concern because it has several mutations or different changes that might have an impact on how it behaves. So the variant has an unusually large number of mutations, several of which are very new, which were not seen in other variants before. As such, it has led to concerns regarding its transmissibility and also the immune system evasion. So though much is yet to be understood on this variant, there are characteristics of the virus like the one I mentioned, the transmissibility, the severity of the disease, the effectiveness of vaccine, the effectiveness of a prior infection, and also the effectiveness of current test and the current treatment. And I want to take a bit of time to talk through on this characteristic. Starting with the transmissibility, this is really just how the variant can easily be transmitted from one person to another. As I said earlier, that much is yet to be understood. It is not yet clear whether Omicron is more transmissible or is more easily spread from one person to the other compared to other variants, including the Delta, which had been dealing with during the third wave. However, there are reports really at this time showing that the reproductive rate, which we call the R naught, or just the way the transmission is spread from one person to the other, for Omicron, it seems to be higher and is estimated at 1.93, meaning that if a person is infected with Omicron, it's likely to produce 2 more infected people. And compared to the Delta, this one was estimated to be 1.47. So this gives an indication that in terms of transmissibility, this might have more chance to extend its behavior as scientists are gathering more information. While on the severity, still all these really things are not much clear as yet, whether infection with Omicron cause more severe diseases compared to infections with other variants. However, so far we have preliminary information which are indicating that there had been noted increase in terms of hospitalization, especially in South Africa, but this might be due to increasing overall numbers of people becoming infected rather than a result of specific infection with Omicron. Initially reported also infection were among young people who tend to have more mild diseases than are getting into the severe condition. So coming back home with the 18 cases which were confirmed of having Omicron in Namibia, these people have age range between 22 to 64 years. And all those, none have experienced severe symptoms or none had been hospitalized. So there is currently no adequate information to suggest that Omicron is more severe than other variants, including the Delta, really, which dominated the third wave, as I have indicated before. But however, we have to be cautious that higher risk population, especially people with comorbidities, elderly people, they remain at higher risk of any variant, including Omicron. I mentioned earlier about the effectiveness of the prior infection. Of course, when you get infected with the virus, it gives you what we call natural immunity. So your body develops those antibodies which can prevent you from getting infection, the same infection for a specific period of time. For now, the preliminary evidence which is out there is suggesting that there might be an increased risk of reinfection with Omicron as compared to other variants of concern. But this information is quite limited, and we will keep monitoring the development, and we update the public as more information becomes available. The last part I want to touch, not the last, but on the vaccine. Of course, WHO is currently working with technical partners to understand the potential impact of Omicron on the existing countermeasures. Countermeasures meaning those things we put in place to control the disease, including the vaccines. However, vaccines remain critical to reducing severe diseases and death, including other variants, as we have said. So current approved vaccines remain effective against severe disease and death, and we still encourage our people to go out in numbers to get vaccinated. Another behavior for the variant is maybe effectiveness on the current test. Because of the changes, multiple changes, it might be difficult, or the virus might behave in a situation, in a specific way that you might not pick it. But for now, the widely used PCR test continue to detect infection, including the infection with Omicron. However, studies are still ongoing to determine whether there is any impact on other types of tests, like specifically on the antigen rapid diagnostic tests, which are known to have a lower sensitivity and specificity compared to the PCR. There is also a concern on what about the treatment which is being provided now. Of course, we know there is no specific cure, but of course, it's more of a symptomatic treatment and supportive treatment. So the treatment which is used for other variants are still effective for managing patients with severe COVID-19 disease, including those caused by Omicron variants. However, assessments are still ongoing to see if there are still any effect given the change to the part of the virus in the Omicron variant. So researchers around the world are really hard at task conducting studies to better understand many aspects of Omicron, and more information will be shared with the public as the findings of these studies become available.
Thank you so much, Ms. Ndavetela. I see Dr. Haufiku has joined us. Doctor, if you don't mind, I know that I asked you in our last session just very briefly about Omicron, and we were speaking of the characteristics of this Omicron variant. And as Ms. Ndavetela mentioned, there's yet so much to be uncovered. But one of the things that I think the general public does understand about this variant of COVID-19 is that it is the most potent thus far due to the number of spike proteins that it has and how many of those spike proteins actually carry the virus. If I'm not, I'm under correction there, but please do correct me. And for all our speakers, please do turn on your cameras when you do speak.
Morning.
Very well. Good morning.
I have to apologize. My battery power is running a little bit low, and I'm talking from home. I may have to disrupt things, but thank you for today's session. I'm almost now in the media about this COVID things. I could as well be one of the workers in the COVID response. You were saying something about the spike proteins and I guess the transmission rate that goes with these mutations that are taking place in the gene makeup that codes for these spike proteins. At the beginning, yes, it was very worrying because I mean, when you see an organism mutating like that, you just don't know what will come out of it in the end. But the relieving news now that we are picking up from scientific literature is that the virus, as much as it mutates so much, it's not as virulent as the predecessor, the Delta strain. It multiplies more faster than the Delta, which is often the case. A new virus normally multiplies and even mutate faster than its predecessor. The good thing and good speculation at this stage is that if it overtakes the Delta in terms of dominance, while it is less virulent than the Delta, then we are in a much better position because you are now flooded with this weakened, crippled sort of a virus genetically that is just floating around, and that may actually help us reaching our herd immunity faster and with relative ease. That's maybe one comment I can make at this stage.
When we speak of mutating, Doctor, what exactly does that mean?
Mutation is basically a genetic change. You know, every living organism has got genes that are the blueprint of life. It's either an RNA, or in most animals like ourselves, it's a DNA. That is the blueprint of life. Anything you are looking at yourself in a mirror is coded for There is a code. It's like a computer program. But this happens naturally, even long before computers were. So there are certain lining of specialized proteins called nucleotides, without boring you technically, that arrange themselves like maybe, I don't know what you call a decent pot in English. This animal.
Centipede.
Yes, they are shaped like that. And they match each other, you know, and they have to be in a certain precise position naturally to produce a certain protein or living organism. That's maybe this long and short of it. Any change, just one change in the amino acid, which are the predecessor of proteins, any change in the amino acid sequences of any protein structure according to the gene change in the genome will produce profound effect of that living organism. And I can maybe give you an example of albinism without any derogation. Albinism is basically a genetic deletion or mutation in the gene that codes for melanins in your skin. Just one or two amino acids missing, you can't produce the dark melanin that you do. So in human, that's it. So in all living organisms, there is this mutation. It's sort of an accident of nature, if you want to call it. But it really has got profound effect on the morphology, on the appearance, and even physiology or functions of the organism. And now in little microorganisms such as viruses, these things are happening every minute. We've seen it with HIV when we were puzzled why you put a patient on HIV treatment and suddenly the viral load is going up and the CD4 count is dropping. And then we actually realized that there's mutation happening in the genome of the virus. So that's basically the mutation issue, if I can end there for now.
Thank you. Ms. Ndavetela, I want to know what could possibly make this Omicron variant a bigger threat than what we've previously dealt with?
Thank you for that question, Nina. Just as Dr. Fico have indicated that, you know, when you have a new development and you are informed about this new variant with so multiple mutations, of course you should be worried, because while the new science is coming in to give you a relief, it is sort of coming closer now. One have to be cautious of what is unknown, because you don't want to be caught unprepared. It's better to be more cautious than relax while you are waiting for evidence to come. As much as we say we are really yet to understand more, what is coming out clearly now and what is also we are observing is when it's come to the transmission, Omicron might prove to be easily spread from one person to the other as compared to the Delta. But of course, we confirmed the Omicron virus, say Omicron variant, saying we have confirmed it in 18 people. That is just a tip of iceberg because of the number of the samples which were tested. We are saying we tested 19 samples, and out of those, all 18 had tested positive for Omicron variant. It's simply meaning that we had been with this variant for some weeks already here before we have confirmed that. Though we have seen our numbers picking up, the number of hospitalization still remain reasonably low. The number of deaths remains reasonably low. So that can give us really a comfort to say probably while we are waiting for more scientific evidence to come, we might be dealing with a lesser virulent variant here, just as Dr. Hofiku have indicated, because more cases were observed among the young population. And of course, it's documented that young population tend to get milder condition. But of course, we cannot relax with this because we know we have vulnerable population. We have our vaccination coverage is still not adequate to protect us enough as is desired. So we still need to put more effort to prevent ourselves.
This variant was discovered by South African scientists, as we've seen in the media, not necessarily originated from that country, but as a result of that discovery by the scientists there, South Africa, along with other Southern African countries, including Namibia, were banned or restricted from entering certain European countries. I want to know what Namibia's response to that was.
Okay, of course, Namibia joined other communities, scientific community, by acknowledging South Africa to the wonderful job which they did by really identifying this virus and also informing the global community on its existence. Though it came now with the reciprocal negative effect, this is really what is expected in the public health community. And it's also legally binding by the instrument which we are using, which is International Health Regulations of 2005. It's clearly telling us that when you discover a new development, it could be a new disease, when you have an outbreak, and also when you have a new variant, it's expected that it's reported or WHO is notified. It's having good advantage, many advantage to others to know. Or of course, it came out that this variant might have been discovered somewhere else before South Africa made a pronunciation, but though we were affected by the negative bans which were introduced globally by this, we really stand with South Africa that they really did a good thing by timely notifying or informing the world of their discovery.
Do you think that the authorities in these European countries are justified in their actions? A lot of people are of the opinion that they jumped the gun. South Africa, announced that they found this new variant. They jumped the gun by banning these Southern African countries from entering Europe. But were they justified in their actions and quick response, seeing that we, after all, did detect the Omicron variant locally?
Yeah, each country is a sovereign entity which have right to decide of what to do within their boundaries. Scientifically, we did not have much evidence to warrant that. Personally, I don't think the response was justified at a time because much was yet to be understood. This variant, even it was detected, it did not prove its wild, virulent, or more severe demonstrated evidence of more severity by that time. And more so, we learned, though it was not pronounced globally, it was also circulating somewhere else. Detecting a variant does not necessarily mean it have originated from there. It might have been brought in from somewhere, of course, then you get the pinch because you are the one who detected. But personally, I think it was premature for those measures to be effected at that stage.
Yeah. Shaligan, are you there?
Yes, I'm here, Nina. I just have perhaps two questions. I'll put the one to Dr. Haufiko and one to Emmy. Dr. Haufiko, if we look at scientists now saying that we have a lag between getting the information and what we're seeing on the ground. So with Delta, we saw a lag before we know that Delta was there, the effect of Delta. Are we seeing the same lag now in terms of there could be what do you call it? A delay in information coming out, because we now see a lot more cases, but hospitalization is very little. Is there a lag? And was this lag very similar to the lag that we saw when Delta hit all over the world? For Emmy, if we look at where Namibia is now and how Omicron is, is reacting, do we see us going to what we had in the third wave? I mean, how the third wave started off and how Omicron is starting off now. Do we see similarities? Do we see any differences?
Yeah, maybe just to respond that, and other people can also add their views. I saw Dr. Akashitai on the platform there. I hope, and maybe others, they can also, and Dr. Leventhal, maybe they will also add a view. Regarding the lag, in comparing the Delta and the Omicron variant, I don't think there is a lag. I mean, this variant was just discovered now recently in South Africa in November. And then the whole world, including Africa, is aware of it. In fact, I am of the view that even the public, the lay people, tend to know much more faster about variant than about public health measure that we all have to adhere to in order as a first line of defense. So in the scientists through many platforms, among those platforms is a platform called GIST. It's stand for Global Initiative of Sharing Some Genetic Material. So the moment you detect a variant, it's an international rule that you must share this information with the rest of the scientific communities without any delay. And then once you publicize your finding, you have to send it to a platform called Medrix. This is a pre-peer review platform for all the scientific discovery. In fact, this pandemic has taught us quite a lot, because in the past, material were stolen, intellectual property were abused, and commercial entity piggyback on that. So it's because of that information of this nature, especially the sequencing of genetic material, must be shared immediately with the scientific communities. So it's my considered opinion that there was no delay or lag as far as the identification and information is concerned with the new variant compared to its predecessor, the Delta variant. That's that. Let me hand over to Emmy there. Over to you.
Thank you, Doc. On the question of how different the situation is when we were responding to Delta and now with the Omicron, of course, it's quite really evident that Delta was more, caused more devastating effect to our system, to our response system, than what we are observing now. Though the number we are reporting these days, they started doubling in a short space of time, I think they are sort of stable as compared to how Delta hit us. And of course, each moment in the development of the response is a learning curve. We cannot remain static. What we had been there and where we are now. Every time, at least every opportunity present, being that difficult moment where we were as we were handling Delta, it really taught us a lesson. That's why we continuing increasing the capacity. Even after the wave have gone down, we were reporting single-digit number of cases, but we never stopped to increase the capacity to make sure that in case we have more severe cases coming in who might need admission, we have prepared more spaces at least. You know, the space or the capacity might not be enough all the time, because we know even the Western community where they have a higher technological system, the health system had been overwhelmed. What about us? But of course, we moved much from the level where we were that time and where we are now. I think we have learned more lessons, which we will then be able to apply during this time.
My question was, I wanted us to look at the Omicron symptoms and how Omicron symptoms vary from that of previous COVID-19 variants. Are they any different?
Symptom-wise, we have not really seen much difference between the Omicron variants and what we have known before. We know symptoms related to caused by COVID infection, they really vary. They had been varied all along. It's not one size fits all. One person have this, the other one have that, but generally we have not observed much change in the way the people are presenting when they are infected with Omicron as compared to other variants.
Then there's a question from Terza Titus on Facebook. She wants to know, can I get a Pfizer booster if I've already been fully vaccinated? And that also ties in with my other question. And Dr. Afiko, I'd like you to come in after Ms. Emmy has answered. Concerning how vaccines are performing in the face of this, I suppose, much stronger variant, for lack of a better word there, because we have seen that efficacy percentages do drop against certain variants. Ms. Emmy?
I think on the booster, we have just communicated to the public that now we are giving the booster or the third dose for those who have received the Sinopharm. We have the scientific committee, which is following the development of this. As now we are not giving what we call mix and match, when you have received one vaccine and you are getting another one later, but there is some developments that are coming through and the public will be informed immediately, soonest once the decision is made on what to do. But for now, the third dose, or whatever what we are called, some people are calling booster dose, it's only available for those who have received Sinopharm.
Nina, one second, if I can jump in quickly there. We have Dr. Kashita, I think he's still on the platform there. He's part of the clinical case management for COVID-19, as far as I recall when I was in the house there. Maybe he can give his view from their clinical interaction. What is it that they found? Is there anything different from the Delta? And I also want to say the virus is the same. It's piece of gene things that are happening within the same virus. So prevention is the same, stays the same, and symptoms are likely to be following a similar route. But let clinicians give their view on that. Maybe that will be helpful.
Dr. Kashita, if you're there, please do join us in the conversation and give your 2 cents. Dr. Kashita?
He may have left. I saw his face in the corner there.
Okay.
Okay. Maybe there's another doctor on the platform, I think.
Luvindao. I saw Dr. Esperanza Luvindao. Dr. Luvindao, I know you weren't scheduled to be part of the discussion. You probably just joined to listen in, but please do share your 2 cents on where vaccines are concerned, because as I mentioned to Ms. Emmy, that we have noticed that certain vaccines, the efficacy percentage does drop with the different variants. Is that the case with the Omicron as well? And then does it help, like Terza asked, to get a booster if she's already been fully vaccinated with AstraZeneca, for example?
Is that question directly to Emmy, or is it open to everyone?
It's open to everybody, but I was aiming it at Dr. Lubindao. I saw that she was also on the platform.
All right, thank you.
In the meantime, perhaps Dr. Haufik, you can talk to us about, how, the vaccines have been performing in the face of these much stronger variants.
Yeah, well, when you say stronger variant, I would like to refer to the Delta. So far, it's the strongest variant that we have. Omicron is still under the microscope. We can't really make any conclusive statement that it's the strongest. When it comes to speed of transmission, maybe yes, we can say it gets transmitted faster than the other variant. Vaccine, as you know, that they are based on 3 different modes. You have the so-called whole microbe vaccine, which is Sinopharm, which is a killed virus or inactivated virus with all its components and without any genetic manipulations. And now a new entry came in from India called the Covaxin, also from an Indian company that was recently approved by WHO. Those are the 2 ones that I am fully aware that they are in the market, and they are wholly inactivated whole proteins, just a virus that is killed. Now you will imagine that such a virus, such a vaccine, which consists of a whole virus with all its components, with all different types of protein. And by the way, the virus has got 4 different proteins. You have the spikes, envelope, membrane, and nucleocapsid. I kept on saying that all of these proteins from the virus does induce some degree of immunogenicity, meaning that your immune system will respond not only to the spike protein, but to the other proteins or viral protein. I think it makes sense, Then you have the so-called RNA-based vaccines, almost all of them across the board, AstraZeneca, Johnson & Johnson, and Pfizer. The difference is that Pfizer doesn't use a vector. AstraZeneca and Johnson & Johnson use the vector, meaning they use another virus and put in the genetic material of the coronavirus that we're talking about, and then make it a vaccine. Now, obviously, the efficacy differs across the board. Interestingly, according to the study, at least that I have read in some of the journal, the efficacy of Pfizer, which is an mRNA-based vaccine, is the highest in variants of concerns, such as the Delta one. If you compare it to AstraZeneca and Johnson & Johnson, obviously that goes also with Moderna, which is the same technology vaccine. Now, interestingly is that you don't find much in the Western media as far as the Sinopharm vaccine is concerned. And I kept on wondering why. I mean, it's a vaccine that is based on the traditional technology of producing vaccine, whether for polio, measles, and all of those things that we know in the past, even the rabies one. So there's not much information coming from most of the literature that we read from the West as far as the Sinopharm vaccine is concerned. But, the vaccine responds not necessarily to the genetic mutation within the virus. It responds to the protein structures of the virus. And therefore one would, and by the way, even the gene that is coding for the spike protein only mutate in certain domain, not the entire genome that mutates, if we look at it, So there is a higher degree of protection, even against variants and variants of concern, such as the one we have in here. But as I said at the beginning, Omicron is under the scientific lens still. I think a lot of data about it in terms of efficacy with the existing vaccine will still come out, and hopefully very soon. The last word I want to mention is that I think in the future, we're looking at possible combination of vaccines. One may be an mRNA-based and the whole microbe vaccine. I think that's a distinct possibility. It's over to you.
Are mRNA-based vaccines the better vaccines?
I wouldn't say the better, but well, the studies from Pfizer and Moderna are pointing to superiority, but these are reports by people who are manufacturing these vaccines, not necessarily an independent, well, they have been reviewed and peer reviewed, I agree. But I say yes with a pinch of sort of salt. I think a whole vaccine such as the Sinopharm an effective vaccine. That's my own personal view now.
All right. Another thing that is sort of a bone of contention, or not a bone of contention, but where opinions vary. And with the little information that we have thus far on the Omicron variant, I just want to know, Doctor, from what you've seen in the past week or so, and what you've read, and in that sense, is it true that vaccinated people are not at risk for reinfection? This is what some people believe, that vaccinated people are not at risk for reinfection. But I've also read some articles, and yesterday I think just an article by the New York Post, which has said that a lot of the cases outside of Namibia, of course, have shown that vaccinated people are more prone to getting infected with Omicron. So what are the facts concerning this?
Well, that question kept on creeping up. People literally believe that if you are fully vaccinated, you can't get infected. I think it's a misunderstanding of the highest order. And I kept on saying that the vaccine, and I think this is really the message, and I'm glad Amy else is here and other officials from the ministry. I think, first of all, the message that we need to send out there to the public is that the vaccine is not a physical shield that prevents the virus from entering your body. I think that's the bottom line. And we need to make the public understand that a vaccine is a biological chemical that goes into your body and wait for the virus to come also in your body. So the battle between the vaccine and the virus doesn't happen outside your body, it happens inside your body. So the aim of the vaccine is to make sure that in case and when the virus comes into your body is ready to put up a battle to make sure that it lessens the effect of the virus in your body. It doesn't give the virus an upper hand. So your body immune system stays in control and gain an upper hand. That is really the bottom line. And that process, that battle between the virus and the vaccine or your immune system is what prevents you from getting severely sick because of a viral infection, and therefore preventing you from dying from virus, largely, and not necessarily 100%. I think that's one message that the public need to understand. And because of the false belief that if you are vaccinated, you don't have to adhere to public health measures. I have met, and I have said this to Eagle FM yesterday, because Wanda was asking why, at the moment as we speak, the many people that are diagnosed now in the last 40-something days or less are those that are fully vaccinated. I told Wanda that, look, I think I haven't got, of course, we have a research gap here. We don't have definite disaggregated data that we can point to. But what I'm thinking is that people who are fully vaccinated are having a so-called higher risk compensation, sort of, meaning that they feel more confident, they feel more protected, they feel they cannot get infection, and they don't adhere to public health measures such as masking, sanitization, because they're so confident that they are vaccinated, therefore they cannot get infected. And I think that's sort of lowering of their guard that make them more exposed than those that are not. That's my view.
Yeah, that makes sense. Ms. Emmy, in his address, the president emphasized quite strongly, the address that he had a few days ago, he emphasized quite strongly on the need to get vaccinated. He made examples of countries who have instituted either mandatory vaccines or tight restrictions on unvaccinated individuals. Is it being hinted that is where Namibia is heading?
Thank you for that question. Unfortunately, I don't have an idea of the discussions around the mandatory vaccination on the table as yet. And, what we are advocating for at this stage is really an understanding for people to make that decision, understanding why they are doing that. You don't need really to be coerced to take the vaccine, but we are encouraging people to get vaccinated. So on the mandatory vaccination, if that is the way to go, it had not really come to the discussion table at my level as yet. And I don't think that's the best thing to do, but better to people understand why should I get vaccinated, and they go out there in numbers to get vaccinated, knowing that just what Dr. Ofigo has explained now. Of course, you can still get infected, but of course, you might be saved from getting severe disease. And that is very practical coming out from the cases we are seeing. Though we had been reporting fewer cases, we still have those unfortunate ones who end up getting into the severe disease, get admitted, even end up in ICU. And mostly, the people who are getting admitted and those who are getting in critical condition, mainly those who are not vaccinated. I think this should give us the message that it's better to have this, to go for vaccination, knowing that it's not the magic bullet that once I get vaccinated, I will not get infected, but I'm preparing my body to be in a better position to fight better.
Yeah. Shaligan, I'm going to be rounding off soon, so perhaps if you have any questions, you can just prepare them. But another thing I wanted to ask Ms. Emmy is we've seen, for quite a while, our number of new cases per day were quite low. I mean, all of a sudden it's spiked out of control, over 800, new cases in 6 days. And then the president addresses us. And everybody, I think, or majority of people expected that we would be on lockdown. But why are we not on lockdown? And why there's zero restrictions, especially as we've seen during the festive time when people, their nature is to get together and their nature is to be a bit less cautious than normal. Why have there been no restrictions placed upon us?
No, I wouldn't agree on the zero restrictions at all. Of course, the public health measures are made there for us to help control the infection, the outbreak or the pandemic we are fighting back. But of course, we know it's have also caused a devastating impact on the economy and the livelihood. So if the data is pointing to a direction where at least you need to put some relaxation, to give space to the public to breathe, to give space for economic activity to thrive, that is what we had been really using. Decision had been made, informed by the data which we are having. That's why after the third wave, when cases started coming low, you have seen that more relaxation started coming in. There's no point of locking people out, knowing that at least the situation is better. But every time the regulations are announced, the public is cautioned that if the situation changes, then again, the measures will be instituted accordingly. So wearing face masks is still on. We are still encouraging that. That is one key measures. Basic sanitation, let's sanitize our hands. That's the message we continue to give. We still have our control where we are requesting for travelers coming in country to come with a negative result. Those are still measures which we are still instituting. We are still advising people to keep a distance. We encourage people to avoid gathering. The number of gathering, even they are spelled out that how many number we should at least limit to, though it's a bit of a liberty, but that is very informed by the situation where we are. As of now, we are still monitoring the situation. It will be made, but these adjustments are not meant like to punish people. It's really in line to respond to the current situation. So you cannot just keep on locking down even when it's not justified.
Yeah. Dr. Alfiku, do you share the sentiments of Ms. Emmy?
Yeah, well, maybe just to move a little bit from encouraging, requesting, suggesting, etc., to full enforcement of public health measures. That is what is going to help us. Public health measures has got no controversy whatsoever. I think everybody is clear about that. When you're wearing a mask properly, it protects you against even the worst variant, you know? If you sanitize your hand, you are covered, you are protected, you protect the next person. If you don't gather in masses, same way. And then of course we can add the vaccine, but I still maintain the position that the vaccine must be given voluntarily and by the choice, not compulsory. I will not agree with a compulsory vaccination. I will agree with vaccination by persuasion after we explain everything to the person. And we must never tire to explain this message to the public. So yeah. I think lockdown at this stage would be irrational. It's got no scientific basis unless a wave really hit us tomorrow or the day after tomorrow, which we hope will not be the case. I think what we need to get is targeted measures where we figure out where most people will be around Christmas time, and we know the Namibian behavior. We reinforce that with public health officers, even the police. We go to the beach and make sure that if we say no more than 100 people at a time, no more such number must be allowed to. The problem we have is that we don't reinforce the public measures. We do not reinforce them. In fact, you see a lot of conniving. You lock a region out, but you hear police allowing certain people to pass there. What does it help?
I agree.
So to save the economy and to maintain a certain degree of public confidence in the system still, we need to have targeted measures, which we know will have a desired effect, but at the same do not polarize society more, because the society is now polarized already by the vaccine. I mean, you look on social media and you see the comment. We don't want to make that worse. If you make the vaccine compulsory, you make the case worse, and you will not get the intended result. At least I put my head on the block for that. So lockdown, no, not fully lockdown in my view. Targeted lockdown, but my plea to government is that we must enforce public health measures, simple, basic public health measures such as masks. That's what we need to enforce.
Yeah. Shaligan, you've got a question?
Yes, just maybe two questions to round it off. One, Dr. Alfiku, you were speaking about, the vaccinated and getting infected. If we look at numbers right now, most of the people getting infected, or we're just seeing a lot of numbers, and we're now saying it's mild. Can it be that most of the countries we're getting this data from is just that their vaccination rate is high, which means the data that we're getting is mild for vaccinated people, because Namibia doesn't share that privilege. We have less than 20% of the overall population vaccinated. Is it just that we don't have enough data in terms of the unvaccinated as opposed to the vaccinated? That's number one. And number two, we have a South African scientist saying that according to what they're seeing and according to their experience or the knowledge, it seems like, and there are signs that COVID might be reaching its end. Do you think that is a fair statement to make, seeing that they're also saying that Omicron is very mild, that signals that we are at the end of the COVID-19?
Well, Shaligan, there's so much, every day about this pandemic. And I think scientists in their research spaces and lab are puzzled every other day. I mean, it's like sending a spacecraft on the moon or Mars. Every day or looking at Hubble telescope, every day there are new nebulous phenomena in the space. This is exactly the same position as far as scientific community is concerned with this pandemic. I think the speculation or the prediction or expression by the South African scientists, which I saw it in some of the literature, it's not off the target, because truly speaking, anything is possible. But I don't think that the virus this will be, in the next 3-5 years, we will have the end of this virus. In fact, what I'm thinking of is that this virus will become like another influenza virus. We will possibly reach herd immunity, either through a combination of vaccination and natural infection, or predominantly due to natural infection, because a lot of people are not keen to take the vaccine. But I would predict somewhere maybe by 2023, 2024, the virulence of the virus may become far, far less and have mild effect on the body, because we will have to learn to live with the monster called the corona. And they will have to make their way. And I think this may be the reason why it is mutating so much, is trying to find the gene setup maybe that is more adaptable to the current environment, without being handed so much and without maybe also not then causing havoc on our lives. So that's the sort of things that I'm looking at, to the point that, you know, corona type 2 will be another influenza virus for which you have your jab annually, or you have it twice or even 3 times a day, and you are not even concerned about its presence. But we can possibly not wipe it out of the planet very soon. That's my speculation.
Shaligan, any other question you have?
So the first question, Dr. Afrika, was, the information that we're getting, is it just mostly based on vaccinated people? Because seeing mild cases, and you know that country has a rate of 70% vaccinated, and we don't have that. Might it be that the information that we're getting doesn't fit the criteria for Namibia? For instance, I mean, we don't have a lot of vaccinated people, whereas countries do have vaccinated people of about 70%. Do you think that could mean that if it does hit Namibia as hard, that it will be more severe? Because most countries' information that all of us are getting is just based on vaccinated, or countries with a high vaccination rate.
Yeah, well, I'm not so sure if I get the synopsis of your question, Shelly, again, but maybe I can expand that. You know, mildness of infection, you can get it because you were vaccinated or because you were actually infected already. Professor Kemper from UK reviewed quite a number of data from Israel in this regard, and the Americans were insisting actually that, look, natural immunity doesn't really provide long-lasting, sustained protection. Therefore, the need for booster vaccines for those, for instance, who took Moderna and Pfizer. But there is a degree of protection if you were infected before. So if we see mild cases, but unfortunately, we don't really have robust data that tells us how many people have been infected in Namibia. I still believe that we had maybe more than 200,000 people in Namibia that were infected with this virus. It can't just be the less than 150 cases that I'm seeing there. I mean, it doesn't click. So there must have been a lot of people, and especially young people that we know, who were infected by this virus and built up certain degree of immunity, maybe not sustained, maybe not reaching the critical level that we want everyone to have. But there is now that combination of people who were previously infected and those few, the 10% odd one that took the vaccine, that are moving towards mild case for COVID-19. I'm not sure whether I get your answer. And again, the gap here really in our context is the lack of research data generated here in our context, you know. And I want to challenge Emmy and the team from epidemiologists there to create cohorts that disaggregate even vaccine effect, even those that are previously infected, the level of serology. I mean, to do serology to determine the level of antibody in our context for those that are vaccinated over a period of time and those that are not vaccinated but were previously infected. That will give us a better picture for our context. Otherwise, we always extrapolate things from elsewhere. Ladies and gentlemen, I have to leave you. I have Africa Public Health Foundation webinar coming in.
Thank you, Doctor.
Thanks very much. Yeah.
Thank you so much. On that note, also, Ms. Emmy, I don't know if you'd like to add anything onto Shelligan's question, and then just give your concluding remarks after that. Ms. Emmy, over to you.
Yeah, yes, I just wanted to add on the statement that of the cases we are seeing, most of them are vaccinated. I wouldn't say most of them. Probably it clinked first when we mentioned that number. But looking in the space of 7 days, from 30 November to the 6th December, we reported 853 new cases. And out of those, we reported that 60 those who were infected. And out of those, 170 are the ones reported who have received their second dose. That is also 20%. So that literally means the majority are those who are not vaccinated. Of course, as Dr. Ofiku indicated, we believe with the third wave, there would have been many people who had been infected. Probably some are not in our numbers, as he have indicated, because if people are not coming for testing, we only catch those who come to be tested. But discussing in the community, you can specifically understand that a person had been sick, but he never went out to the testing site. So we cannot just add a certain factor to say, probably there is so much number of people who are infected, but we are counting facts for people who know they tested positive. That's why with this type of outbreaks, you tend to test continuously. With some outbreaks, you start linking cases epidemiologically, but with the type of the pandemic we are fighting, of course, is still desirable when resources allow for you to test, for you to really to understand the shares. Most are those who were vaccinated, might not be true. But this leads me now to the message which I want also to leave out to the public, that we get this information from that form which we request, or people are requested to complete. When you go to the private lab to be tested, at times you are given that form to complete yourself. At some facility, the staff member at that facility, they complete by asking you the information. That information is very, very important to inform us to understand the situation. Even the information on who had been vaccinated, it's coming from that information. If you present with symptoms form, so we really call upon the public that whenever you are completing that form, we call it a case investigation form, or you are asked by the staff member at the testing site as they are completing the form, let's be honest and provide all that information, because that is the one which is giving us and to understand the situation at a glance without really going into much detail and conduct some research. So that is what we will do. And maybe just the last comment that as we are approaching the festive season, I think our reference point is last year, second wave, it really hit us hard this time because it peaked during Christmas Day. And you don't want that to be repeated again this year. It's mainly because of our behavior. Dr. Ofiku emphasized the enforcement, but let's be cautious as a nation that we don't need to be restricted. I think our honorable minister had been giving message, at least to discourage year-end function. You know, when you are gathering at these social events, of course, as much as you want to keep your precautionary measure observed, you might be sipping your drink. Of course, you cannot drink while you have your mask on, you have to take it off. And that time you are chatting. just by chance that one person is infected in that group, it can cause more infection to others. That's why we call those events as super spreaders. We should try to avoid those as much as possible and be cautious as we are trying to reach out to travel to our families, to be closer with our relatives. We should know that COVID-19 is still here. We should not just be focusing on which variant are we fighting at a time. It's still COVID-19. Precautionary measures, preventative measures, they are still the same, basically. So we just need to observe that and adhere to them. Thank you.
Ms. Emmy, thank you so much, and thank you for your time this morning. On that note, we've come to the end of this morning's hashtag Ask the Experts session. Do note that this episode will be up on YouTube next week. To Shaligan, also thank you so much. Salma Moses, thank you so much. Until 2022, be safe, look after yourselves. We'll see you then. Thank you and goodbye from myself, Nina Katangana, and the NMT team.
The Ask the Experts platform is a monthly segment that offers an opportunity for Namibian journalists to engage noted experts in one-on-one discussions on the COVID-19 pandemic. Journalists get to pose questions to experts in various sectors to ensure that they are equipped with the necessary information to better inform their readers, listeners, and viewers. COVID-19 is our common enemy. Together, we can defeat it. Proudly brought to you by the Namibia Media Trust and the DW Academy.